We've gone through a lot of the main practical approaches to reducing the amount of lameness in your flock. But I think it's important to actually look at a hoof and identify the key areas where we'd actually see some of the lesions. There are two main causes of lameness: non-infectious and infectious. Non-infectious lesions are those such as toe fibromas and shelly hoof or white line disease. Toe fibromas can be as a result of overpairing, so if we overpair and cause issues with the soft tissue that are inside the hoof, then that can cause a little reaction to occur and get an overgrowth of that tissue. And that can be very painful whenever the ewe actually walks down on that lesion. Unfortunately, there's no treatment for toe fibromas, and those animals ultimately end up being culled from the flock. Shelly hoof can be as a result of a distortion in the growth of the actual hoof. It can sometimes be seen after an episode of foot rot, and the mud can actually impact inside the hoof horn and can cause discomfort and lameness when walking. When we're thinking about the infectious causes, we're thinking of things like scald, foot rot and cod. And you can see here on this ewe, she's a normal healthy ewe, a good healthy foot with good foot conformation. Scald is normally affecting the skin in between the two hooves, and you can sometimes see like a redness or even actually a grey colour to that skin. Scald can then lead to foot rot. So scald causes damage of this skin, and then the bacteria that cause foot rot, which actually already live on the hoof and on the skin, then causes underrunning of that hoof, and then the horn falls off. The common site where we'd see cod lesions are here at the coronary band, so at the top of the hoof here. That's normally where you'll be looking for. So if you're buying in ewes or buying in lambs, take a look here, turn over the hair and see if there's any lesions here at the top of the coronary band. So what's your approach to tackling lameness in the flock?
The approach here on this farm would be to cull out the chronic offenders. So we would start with giving a sheep a chance. She'll be treated, topical antibiotics and maybe an injection, and we'd mark her and follow up on her, and if she re-offends, she's out the gate.
You mentioned, Richard, that you have a very strict culling policy here in the flock.
Yes.
Where does foot bathing fit into your overall lameness strategy?
Yeah, well, I suppose about 10 years ago we had a bit of a problem with CODD, and we had to do a good bit of foot bathing over a short period of time, and we got rid of a lot of chronic offenders. Now we're less dependent on sheds and we're using the outdoors more.
And that's probably ultimately because you had a really strong culling policy. You probably removed a lot of ewes from the flock that had both infections due to CODD, but also as well as that some chronically infected foot rot ewes as well.
Absolutely, taking out the chronic offenders is very important.
So we've spoken a lot today about lameness, Richard. Can you tell us a little bit about the impact of lameness on your flock?
I suppose at flock level here, it would be financial and labour would be the two things. And on a financial side, there's the loss of thrive and from lameness, and also then you have maybe the loss of a good ewe from your flock, so financial side of things. And then on the labour side of it, if you're getting in sheep, foot bathing them and pairing feet, whatnot, there's a lot of work to that, and you'll be trying to avoid all that. So.
And then in terms of, Richard, actually your loss of genetic potential if you have to remove a ewe from the flock, can you tell us a little bit about that?
Yeah, you'd be trying not to sell a good sheep that you're minding the genetic material on or whatever, and to sell a ewe because of a lame foot, that's a killer, but sometimes you just have to do it.